I belong to the first batch of medical students from the KOTTAYAM Medical College in Kerala, India. When 50 students were selected for the KOTTAYAM Medical College in 1961, all arrangements to start a medical college in KOTTAYAM were not completed. So the first batch of KOTTAYAM Medical College began their initial years in Trivandrum Medical College with the 1961 Trivandrum Medical College batch. This year, 2015, KOTTAYAM and Trivandrum batches of 1961 completes 50 years after our medical graduation, and we will have a reunion of both batches together on August 30th in KOTTAYAM. Today I will try to recollect few of the things about our medical education as well as our career, professional career after the graduation. During this past 50 years, we were fortunate to witness and participate in an incredible progress in the field of medicine beyond anyone's wildest imagination. When we started our career in medicine, there were no ultrasounds, no CT scans, MRIs, or telemetry of the heart. Even the concept of intensive care units was only slowly evolving in Europe and America. The American President Eisenhower died in 1961, the same year we joined the medical college. Recently, I read the newly released medical records about the treatment given to President Eisenhower following a heart attack. One day at midnight, Eisenhower developed chest pain. His personal physician, Dr. Howard Snyder, examined him at home and gave an injection of morphine to relieve pain. The president was shivering, possibly because of falling blood pressure, and the only thing the doctor could do was to ask First Lady Mamie Eisenhower to snuggle with her husband in bed to keep his body warm. With morphine, President went to sleep, but when he woke up about 3 hours later, he was still having chest pain. So he was taken to the hospital by a car, not by medical ambulance, and he was treated by the most famous cardiologist of that period, Dr. Paul Dudley White. But the only additional thing this famous cardiologist did was to take an ECG, start oxygen through his nose, and give phenobarbital for high blood pressure. After reading this, I was thinking today, even a first-year medical resident could give several-fold better and effective treatment for any patient reaching the hospital with chest pain. As I was snickering over Eisenhower's treatment by his doctors, suddenly a thought came to my mind. My God, 50 years from today, in the year 2065, if one of my great-grandson happens to be a doctor, and if he happens to go through my writings or viewing one of my television talks on medical topics, he will also snicker at my poor ignorance and limited knowledge in medicine. As a doctor, what I have learned in the last half century is that we have acquired only a small, minuscule of knowledge, considering what is yet to be learned in the future. Angioplasties, bypass surgeries, keyhole surgeries, robotic surgeries, all these were not even in the distant horizon when we started our medical career. A stethoscope, a flashlight, a reflex knee hammer, an ophthalmoscope, some x-rays and few blood tests and urine tests. These were the only things available for a physician to make a diagnosis those days. Modern medicine, as we know it, started slowly after the beginning of the 19th century. Taking a medical history and doing a physical examination of the patient to make a diagnosis took some time to become part of even Western medicine. Before that, in England, barbers were doing the healing art. Of course, they cut, cropped, and chopped and treated without doing history or physical examination. In the early 1970s, when I was training in England, the surgeons were not called doctors there, but they preferred to be addressed as Mr. So-and-so, as a nostalgic reminder to their predecessors in the profession. The basic part of modern medical practice is taking a medical history followed by inspection, palpation, percussion, and auscultation. Somehow, the first among these to be started or practiced was percussion. An Austrian physician, Leonhard Ohrenberger, was the son of a bar owner. He noticed that as a child, his father tapped on the large barrels of wine to check the level of the wine so that he can reorder for new supplies of wine when the level went low. The young Ohrenberger, when he became a physician, started percussing or tapping on the bodies of his patients to check the fluid accumulation in the lungs or the abdomen. Another French physician, Laennec, one day noticed two boys playing with a stick, one scratching at the one end of the stick while the other one was listening at the other end. This gave him the idea of auscultation that resulted in the modern stethoscope. In 1960s, teachers in our medical colleges taught us how to diligently take a medical history, then inspect, palpate, percuss, and auscultate the human body to make a diagnosis. Medicine is a science, but it is also an art. One human being goes to another human being and reveals the most private and intimate and personal information to them, and then disrobes himself or herself to be touched and examined by the other. This is the most sacred ritual in the practice of medicine. When the most illustrious professor of medicine in Trivandrum Medical College, late Dr. Pai, when he made his last visit to Chicago, I was fortunate to spend some time with him. One thing I specifically noticed was when talking to Pai sir, you could always feel that his whole attention is given to you. He taught several generations of physicians the importance of empathetic, active listening, the first step in reaching a diagnosis. No wonder he was the most beloved, revered physician for a whole generation of people in Kerala. Dr. Matthew Parakal in Kottayam Medical College taught us how to percuss the human body to determine the size of organs like liver, kidney, spleen, etc. I still remember how he placed his middle finger of his one hand over the patient's body and with the middle finger of the other hand percussed or tapped over it. This was the only ultrasound available in Kottayam in those days. Dr. George Jacob was the first cardiologist in Kottayam and the only doctor with an ECG machine in his office. He taught us about heart enlargement, arteriosclerosis, coronary arteries clogging with blood clots and all. All this he taught without an echocardiogram or angiogram. But he instilled his love, enthusiasm and passion for his specialty that few of his students today are great cardiologists around the world. Once Dr. Keshavan Nair, the professor of surgery and our principal in Kottayam, asked me to examine an enlarged thyroid gland in an old lady. Once I finished examining, he asked me whether the thyroid gland was overactive or underactive. While I was thinking for answer, he took a reflex hammer and tapped on the knees, which showed a sluggish, slow reflex. He explained this was the sign of hypothyroidism, a test he instructed one must do before doing any other expensive test. Dr. Parameswaran, our chief of medicine, took us for medical grand rounds, from bed to bed and often in between the beds where the patients were lying in the general ward, and taught us the basics of general medicine. Most of us who left for America or our Western countries have worked in hospitals where modern cutting-edge medicine is practiced. But sometimes, today, medical grand rounds in America and all, where the physician and the attending physician and trainee physicians get together in computer rooms. All relevant X-rays and EKGs and lab tests will be on the computer. Only thing missing will be the patient waiting alone, somewhere in a bed, oblivious to the discussions. In Chicago, I used to refer difficult case to the University of Chicago Hospital, where you can find a specialist for even the rarest of the rare diseases, devoting his whole life for research on such diseases. University of Chicago, which has produced 89 Nobel Prize winners, has also several great physicians in the rostrum. But occasionally, one of the complaints patients refer to the world-renowned specialist is that the doctor never touched me and he never listened to me with the stethoscope. I always try to explain to these patients, these specialists, world-renowned specialists, do not have to touch or listen to the stethoscope, as they were already examined by other very competent physicians before the specialists saw them. Though these professors, great physicians at the university, may know everything about the patient's disease, even at a molecular level, patients were not happy till the doctor does the age-old sacred ritual of touching the patient and listening and doing the history and physical. Here we have a special bond to the teachers in Trivandrum and Kottayam Medical College, who for the first time introduced and guided us through the very basic but sacred early baby steps in medicine. Irrespective of where we are living or where we practice medicine, the people of Kerala also deserve our gratitude as we celebrate the 58th year of our medical degree from Kerala. According to the Association of Medical Colleges in America, average cost for 4 years medical education here is $280,000, equivalent to about 2 crores of Indian rupees. Even in India today, attend a private medical college will cost hundreds of thousands of rupees. But in 1961, 290 of us were selected on merit basis in the 3 then existing government medical colleges in Kerala. And we were given a decent, good medical education, which enabled us to stand shoulder to shoulder with medical graduates from anywhere else in the world. But our tuition fee was only 1,440 rupees for 4.5 years of education. It is about $24 US. Even considering the inflation and the big change in the exchange rate, this was a hugely subsidized education we received in Kerala. As we are indebted to our parents and to our teachers, we are also indebted to the people of Kerala for subsidizing our education. Most of us coming from ordinary families would not have become doctors if it were not for the government medical colleges in Kerala, supported by the taxes of the ordinary people in Kerala. This is Dr. Roy P. Thomas from Chicago. See you all again next week also, the same time on Kairali TV.